Well, next at 10, we've watched COVID cases and quarantines tick upwards by hundreds in the schools around the area over the past week. Our Naomi Coles brings us the biggest concerns of parents and public health.
We're a little bit more on high alert to it. I am immune compromised, so
In the Madison Metropolitan School District, where COVID-related quarantines quadrupled in a week's time, the Kloack family has 4 children from elementary to high school. The rising cases have them very concerned.
Okay, if this is 6 days, what's going to happen at 30 days? What's going to happen at 60 days?
Perhaps their biggest question, why doesn't MMSD have a plan for what happens in a school building if COVID spreads too far?
This is what we're going to do. If this happens, we will proceed this way. If this happens, we will proceed this way. We're assuming those things have happened. It would just be nice to know.
The district doesn't yet have a plan like that's finalized. A school spokesperson tells me they're working on it.
at least if we had that information for that framework, we could prepare better for our children and for our home situation.
Across South Central Wisconsin, and especially at MMSD, school COVID cases are ticking upwards. We launched a News 3 Now school COVID tracker on Monday. That's when we knew of at least 700 quarantines for positive cases and close contacts in about 24 districts. By Friday, that number ticked up to almost 1,400 quarantines, with many more likely because not all school districts are reporting close contact quarantines.
This is bad, unfortunately. When you look at our state map, county by county or district by district, we're really experiencing high levels of spread of the virus everywhere that we look.
As cases rise in Madison, spokesperson Tim Lamont said earlier this week, quarantines aren't a cause for concern.
You see those numbers increase, especially around the contact tracing. Just remind yourself that this is what was expected. This is out of precaution.
But as the spread continues, opposition to protective measures like masks have public health officials very worried. A 13-year-old died this week in the Fort Atkinson School District. Officials are investigating whether his COVID diagnosis contributed to his death. Only after that did the school put a mask mandate in place.
I mean, where we are getting case notifications, multiple case notifications every hour. This is a huge issue. I mean, schools right now are causing the spread of COVID-19 in Jefferson County. That is almost undeniable at this point. It is a huge issue because there are so many things that we can do to prevent this, right?
We have open school-wide investigations that we're helping with at the state health department, and we've also seen some outbreaks related to sports. So our message to all schools is to use all the prevention strategies that we know work.
Many have minimized the risk of COVID to school-age children throughout the pandemic. The state's top doctor says that's very dangerous, especially now that the much more infectious Delta variant is pretty much the sole spreader.
All age groups, all people, when we have a generalized epidemic of this highly infectious variant, are at higher risk of getting infected. And in that setting, we're going to see a lot more severe cases because some certain percentage of cases, even among children, can be severe and sometimes fatal.
A risk many families aren't willing to take.
We're trying to be as vigilant as possible.
For News 3 Now, I'm Naomi Coles.
Okay, so you can find our News 3 Now dashboard Naomi mentioned online right now. We'll be updating that with COVID cases in your school district throughout the year.